Disturbing numbers. Despite a drop of more than 50% in the prevalence of cigarette smoking in the last 5 decades, 40 million Americans are still lighting up, but more so in the South. A unique state-by-state analysis shows that proportionally smoking-related cancer deaths were highest in adult smokers living in southern states. And there's information about alcohol-related deaths as well. Dr. Ali Kazraian from Kazraian Urology, back here on the morning show. Good to have you here.
Thank you for having me.
So it seems that there's a bit of a contradiction. There's a drop in the number of smokers here in Florida, but the number of deaths, cancer-related deaths, is on the rise.
If you look at this, basically over the past 5 decades, the amount of smoking has decreased. However, people are still smoking. If you look at this, smoking remains the most preventable cause of death from both cancer and other sources or causes of death, but still 40 million Americans smoke. And that translates into preventable causes of death. In this particular study, they found that in a unique state-by-state analysis, about a third of cancer-related deaths are related to smoking, and in the South, it seemed to be more prevalent.
And men and women seem to share the cancer burden equally, but there's a disproportionate amount of cancer deaths when it comes to the African-American population.
It's interesting that in a lot of studies that seem to be true. In this particular study, when they did a very, very breakdown analysis of this, they found that the racial propensities seem to be less of a factor than the geographic policy things associated with taxes on tobacco, laws related to smoking in public, and things of that nature where it could have impact on the prevalence of smoking. For example, a policy in New York, when they increased the tax from 8 cents to $1.50, they banned smoking in public places like restaurants and bars and created various different policies. They found an 11% decrease in the prevalence of smoking. That translates into 140,000 less people smoking.
Does this tell us that we need to, number one, improve access to health care, and number two, revisit our public health access policies?
If you look at this, one of the things one of the basic things is stop smoking. You know, we discuss this a lot of times in all sorts of different healthcare plans. We talk in terms of discussions with your primary care physician and also media outlets. Stopping smoking is one of the greatest things actually that's been done in healthcare policy in terms of shifting the paradigm of preventable causes of cancer. However, still 40 million people smoke and it causes a significant amount of cancer. One thing that we can do in looking at this is you marry policy with discussions with your primary care physician. This is a conversation that primary care physicians, all your doctors need to have with patients and people that are looking to quit smoking. And if you are looking to quit smoking, if you are smoking, reach out, because it's not an easy thing to do, and it's an impactful change in your life because it's one of the most useful things you can do with regards to cancer risk, cardiovascular health, and a general health change that can have impactful change in not only the quality of your life, but the longevity of your life.
I think it was 62 or 63 when the Surgeon General first came out with the warning about cigarettes. I mean, all of a sudden, people just started throwing packs of cigarettes away like crazy. My mom and dad used to smoke, and that warning opened their eyes. What is it going to take to open people's eyes to the reality today?
I'll tell you, I'm always shocked when people don't quite get it. So I think what I find on a day-to-day aspect in clinic is either an impactful moment in someone's life where they see the impact of smoking in their life. So a lot of people I find, they get a cancer that's related to smoking. As a urologist, bladder cancer is the big one, which was actually studied in this particular analysis. The #1 cause of bladder cancer is smoking. Lung cancer, we see that. And so if you look at that, that is impactful change. Hopefully we can get people to see that before, and hopefully we can get people to not start smoking at all. You know, that is the most impactful change we can make. So people at younger ages who are thinking about smoking, if you never start, that's the most impactful moment that you can, deciding moment that you can make to not enter the paradigm that you even have to consider some of these things that we see in the study.
Still, you have a lot of younger people who are using e-cigs or vaping.
Absolutely.
And they're fooling themselves into thinking
Absolutely.
that that's safer.
If you look at that, the studies are, the more we learn about e-cigarettes, the perceived safety and the perceived benefit of e-cigarettes versus conventional smoking, we're finding that the dangers of e-cigarettes are beginning to be understood a little bit better and soon going to be a lot better understood. And some people are talking about this as a gateway to conventional tobacco smoking.
Dr. Ali Kazraian.
Thank you very much.
Good to have you here.